So I'm introducing our speaker for today. She's a lovely, delectable Mrs. Edith Adanma Ohadeko. I hope I got that right. Mrs. Edith Adanma, also known as Ada, is currently a senior health service manager in one of England's NHS hospitals. She studied anthropology, earning her Bachelor's of Arts degree in 2002. Focused on medical anthropology due to her fascination on how different cultures deliver healthcare. Her final paper was on how HIV/AIDS impacted Africa, resulting in a large number of orphans. She went on to study nursing, where it became clear that her passion was in the areas of pediatrics and community health. She earned her Bachelor of Science in Nursing degree and qualified as a professional registered nurse. Ladies and gentlemen, it's my pleasure and honor to welcome Ms. Edith Adanma. Welcome, ma'am. Over to you.
Good morning to participants joining us from the US, and good afternoon to those of you in England and in different parts of West Africa. It's an honor to be here on behalf of mDoc to deliver this presentation to you. Thank you for the introduction. I'm happy to start if you are. Okay, so the first series of maternal health actually started during COVID. In 2020, I joined a group of doctors and other health professionals who talked about pregnancy during COVID, and that was in 2020. So this is a follow-up presentation that now looks at, okay, life after the baby, and the audience is different. It may be that you're pregnant, it may be that you've had your child, or it may be that you're a carer looking after someone who's just had a child. So I'm gonna cover different aspects of life after the baby, looking at postpartum care and also how to cope with stress. Next slide, please. So as I said before, postnatal care is critical to the long-term health of both the mother and child. In order for any woman to be an effective mother, you have to look after yourself first and then baby. And there are certain things you should look out for after birth. Next slide, please. So there are different aspects of pregnancy that's quite common to women, but not all women experience the same thing. So I'm just going to quickly touch on some of these things on the slide. And in this presentation, I hope other women are encouraged to speak up about their experiences with childbirth, and also not just childbirth, after childbirth, because you find that you're not alone in some of the things that you experience. So I've mentioned pain, because pain can be, you've had a natural birth, but you still have some discomforts. You've had an episiotomy, which means you've had a tear or a procedure to expand to enable you to have a normal vaginal delivery. You may have had a C-section, and you have pain in the site of where you were cut, and perhaps you can't bend or lift as advised by the doctor. So some things, that's quite common in pregnancy is the pain you experience afterwards. And then there comes the sleeplessness, because your baby may be someone that, wakes every hour, every 2 hours, doesn't sleep much at night. So now, your sleep is disrupted because you have this new baby in your life. And that can be quite difficult. I'm going to leave physical changes to your parents last. Fatigue and tiredness is kind of similar to sleeplessness. You're tired now because your schedule has changed. You have a little person in your life you now need to look after. So you find yourself tired because your sleeping cycle has changed, your pattern has changed. And there's also emotional changes after you've had a baby. Your hormones are changing. So you're more tearful. You may experience that you cry more. Someone may say something slight that may not have ordinarily offended you, but now you feel offended. You go through different types of moods, and you may be more tearful, and that's normal post-pregnancy. And some women don't really know that. They're amazed that they've become more emotional than normal. And then there's breastfeeding challenges. If you are a mother who wants to breastfeed, you may find that breastfeeding is not easy as it seems on TV, or as you read about, or as you've been advised by other moms, because perhaps the baby doesn't latch on easily, which means, the baby is not positioned properly, and that's frustrating for you if you want to breastfeed. So those are some of the challenges. But one of the most common challenges that women do spend time, we talk about, and you see it in the media, is physical appearance about pregnancy. We know that there's a weight gain, which is normal and expected, but there are other things physically that transform the body that's not often talked about. Hair loss, because of the hormonal changes in your body. Lots of women lose their hair after having babies. That is something that is a struggle for lots of women. I've put incontinence. If you're not clinical, these are women who basically experience changes in your bladder when you cannot hold your urine for long periods of time, when you may have been able to do that before you had your child. So suddenly you have to urinate and you cannot hold your urine. And sometimes you may even experience, urinating on yourself slightly. These are, again, things that change that we don't talk about, but it does happen to women. And while I talk about physical changes to your appearance, sometimes some women suffer from what is called diastasis recti, and I can put my hand up to say I do suffer from that. After my second pregnancy, I experienced diastasis recti, and even after my third. Basically, this is when the pressure in your belly forces a separation in your muscles. So your muscles that are like this, and they split. Okay, it's something that's not talked about, and some women, they end up having a pouch. So your stomach is no longer flat. You've had the baby now, 6 months now, even a year sometimes or more. Your tummy has not gone back in. You've done all your exercises, you've worn all those belts, but you still have a pouch, and it's not talked about. And it's very common in women. In fact, about a third of pregnant women experience it and have it unknown to them. And it's important because it can cause lower back pain, and it can affect, it can cause your urine to leak. And if you have constipation, so, difficult to pass stools, it's very difficult because you can push the contents, what's inside your stomach out. And because of that pressure, sometimes the tissues tear and you can develop a hernia. A hernia is when your belly button, the umbilical turns out. So if you're wearing a tight blouse, suddenly your belly button protrudes, and that can happen. So I want to say that I've experienced a hernia after my second pregnancy, as well as diastasis. And some things that you should do, and not, as I mentioned, constipation, your diet matters because you don't want to put any strain on your body. So to avoid that, and I'll go into it, as I go along the presentation, you want to eat a high fiber diet plus fiber, bran, wheat, lots of fruits and lots of vegetables, and I'll cover that again as we go on. Other things are, you want to avoid lifting heavy things if you have a hernia or you have the diastasis recti, where you see your stomach protrudes a bit. Even lifting your baby is considered heavy, especially when they're 2-3 years old. Lifting heavy things is not helpful. They advise against that. And you have to be careful with exercise. Women are so desperate now. We're so desperate. We have so much pressure to look a certain way after you have your baby. So you want to do sit-ups because you want your stomach to be flat. But if you have this diastasis recti that I'm mentioning, you actually have to do a different form of exercise because you can potentially be opening that gap in your stomach wider and wider as opposed to bringing the muscles together. So you have to be very careful with exercise. So the treatment, you say, is to try to do core, muscle exercises to strengthen your core, your belly. And you should do it before pregnancy. There's something called Pilates, which I'll talk to you about again. And sometimes if it doesn't resolve, you may need to have surgery. Next slide, please. Okay, so having a baby is a life-changing event. Whether it's your first child, even if it's your third, sixth, whatever number the child is, it's a life-changing event. Anytime a newborn comes into your life, the dynamics in your family will change. Everyone has to accommodate this new person. Your schedule will change. There's so many things that evolve. There are some risks that we as Black women, African women, are more prone to sometimes than other cultures, okay? And there's a lot of research about this. And again, it's not talked about. And outside of Africa, the maternal death rates, death in Black women is quite high. And some of these things I'm going to talk about are not looked at, are not researched, are not picked up or assessed. So excessive bleeding, you had your baby now, but you're bleeding excessively, more than what the doctor told you to expect. You have to go back into the hospital because you may be hemorrhaging. That's loss of blood. High blood pressure. Now, ordinarily, some of you may not have blood pressure kits at home. You're not checking blood pressure regularly, and you don't suffer from high blood pressure. So how would you know you have high blood pressure? some of the things around, like, you wake up first thing in the morning, you have a splitting headache, a throbbing headache, check your blood pressure. That's not normal. Postpartum preeclampsia, again, I will go into all of this, and HELP syndrome. And then very commonly known, postpartum depression. Next slide, please. So what's postpartum preeclampsia? Some of you may or may not have heard this. So preeclampsia has a lot to do with blood pressure that it rises because there's so much demand on your body when you're pregnant. So sometimes your blood sugar, you can become diabetic in pregnancy, although you're not normally diabetic. You can suffer from high blood pressure during pregnancy, although you're not someone that has hypertension. So there's pre-eclampsia, right? This condition happens, it's high blood pressure during pregnancy, but it can also happen after pregnancy. And some mothers don't know this, they're not told this. And they have all these symptoms they present with, and they go to the hospital and they get misdiagnosed, sent back home to say, oh, it's just after pregnancy, you'll be fine. But you should really look out for it. So it can happen to any woman, just even 6 weeks after your baby is born, you have a 6-week-old baby and you develop these symptoms. So you may have pain in your stomach. The real indicator that you should pay attention to is severe headache. If you wake up in the morning from a severe headache, more than one day, you've hydrated yourself, you've had a glass of water, you start feeling dizzy, you see a lot of spots in your eyes, like growing up. Another good sign is you have swelling. Wake up, your face is swollen, your hands are swollen with this throbbing headache. It's really painful. And you can't breathe. Go and see your doctor. Now, this slide is American-based, but wherever you are in West Africa, whether it's in Nigeria, go to the hospital, go to the clinic and get help, because this is not normal and it's an emergency. Because the risk is you can have a stroke, which has a lot to do with your brain. You can have seizures, epilepsies, fits, and you can actually die. So I'm not saying this because I want to frighten you. I just want us as women to be more aware that as you bring your lovely baby home, you can become unwell, and there are things that you need to pay attention to and seek medical attention for. So that's postpartum preeclampsia. Next slide. HELP syndrome. Some of you may not have heard of this. And the reason why I brought this up is, during COVID, I had my third child during COVID. So in 2020, I was pregnant during COVID, had my third child. And I was reading a lot because, I'm at home, there's not much to do, waiting for the baby to come. And I read about a woman in the United States, Black woman, who had this syndrome. The doctors didn't pick up. They didn't, after she had a baby, she kept telling the nurses and the doctors that something was not right with her, that she didn't feel okay. That something's just off. And they kept ignoring her. She's fine. Your pain is fine. You're okay. And she was diagnosed with this HELP syndrome. And it's not something that's commonly diagnosed. And I'm going to tell you what it is. On the slide, it has, the symptoms. You have pain in your stomach or your chest or even your shoulder, okay? Especially your right upper side. You feel like throwing up. You have a headache, just like the other one, preeclampsia, remember? Very similar conditions. You have a headache that won't go away. You're taking your paracetamol or your Tylenol, acetaminophen, whatever you call it, in your countries. You're taking, pain medication is not resolved. You start bleeding. But the swelling in your face and your hands is really a big deal. And now you can't breathe. Again, it's a medical emergency. You need to get help. It's life-threatening. And it's similar to preeclampsia, as I mentioned. And it happens normally the later stage of pregnancy or soon after you've had the baby. And the reason why they named it this HELP syndrome is because the H, right? I'm not going to go too much into medical because some of you might not have the background, but the H is for hemolysis. Basically, your red blood cell starts to break down. That's what the H is for, hemolysis. The EL is for elevated liver enzymes. So when they do a blood test, you go to the hospital, they'll take your blood. Your liver function, your liver enzymes will be very high because of this HELP syndrome. And because of this, a lot of doctors normally think, oh, maybe this patient has liver disease, or maybe it's flu. Actually, they should screen for the HELP syndrome. And the LP is for low platelet count, which has to do with your blood level. So as I said, it's really hard for doctors to pick this syndrome up because it's just like preeclampsia. Both very similarly have similar symptoms. But you can experience this HELP syndrome and not have any headache. You may just have the swelling in your face. So the message I want you to take home today, tell your mothers, your aunties, sisters, cousins, other women that you know, that if you have a baby or anyone you see, they've had a baby, you notice their face and their hands are swelling, they're having problems breathing, they're complaining to you about a headache, that they need to get medical attention because this can prevent that. Next slide, please. Okay, so postpartum depression. This, I think, it's common in terms of, it's in the literature. We read about it, we hear about it often. And what some of us don't recognize is that depression doesn't just happen after you have your baby. While you're pregnant, you can feel depressed. And in our culture, as African people, or even Black Americans, people often say to you, oh, you should be thankful you have a baby. What a blessing, what a gift. How could you be depressed? There are people that don't have children, that can't have children, that are struggling to have a baby. You have a baby or you're pregnant and you're depressed, you're ungrateful, because they don't understand that this is actually bigger than you. So there is such a thing as postpartum and perinatal, which means during the pregnancy, depression. The first picture you see that you can be pregnant and suddenly, because you're tired, you're not used to being tired, you can't sleep, you know, you're having a lot of symptoms, you have a rough pregnancy, you know, it's made you more irritable. So I was very irritable in my third pregnancy. The smallest thing would irritate me, and my behavior changed. And my husband complained, the kids complained, and mommy, every time you get upset so easily, you know? I'm not saying I was depressed. I'm just saying that some women can't cope with these changes, okay? So during the pregnancy, they have a sense of hopelessness. They feel down, their spirit, their energy levels. They feel really bad that they're going through all these changes. And they become even moodier, you know, maybe less, not eating, not drinking, low. This is what they call perinatal depression, how you're feeling and struggling during your pregnancy. Now, after the baby's born, you have postpartum depression. And what happens is normally the nurses assess the mother to see how are you getting on after you have the baby. They'll ask you questions about yourself, because they want to make sure that you're coping well with this new change in your life. You're coping well with the baby. But there are some women who are at risk, more at risk for postpartum depression than others. And the slide on the right-hand side tells you some of the examples. Women who have lack of social support. So let's say you're expecting a baby. Your parents are no more. You don't have a mother or father, they've passed away. You moved to a new town, you don't really have much friends, you haven't met anyone, and your husband travels for work. You can easily go into depression because you feel alone. You have your baby, there's no one to talk to, you can't turn to anyone for advice. You can easily become depressed in terms of how you feel, your mood levels, and how you're coping with the pregnancy. That's a risk factor. Other things are risk factors for postpartum depression is you're a single mother. You never planned on, you know, perhaps you just recently divorcee, or your husband or your partner, whatever you want to call, have split. And now all of a sudden you have a baby you're going to look after on your own. It's a scary world. It's not something you envision for yourself or plan. You can easily become depressed because suddenly you're overcome with so much emotion about how are you going to do this on your own. Another risk factor, so remember, lack of social support, quite common single mother, is you didn't want the pregnancy. You got pregnant, but you never planned for a baby. You didn't want it. So you're really unhappy. And now you have to look after this child that you never planned for. That can make you depressed as well, because now you have to see you through. Another form of, another risk factor is your baby's unwell. There are many cases where the baby is born, but sadly the baby now has a condition, has a disease, long-term illness that you didn't plan for. No one prays for this, no one anticipates this, no one prepares themselves for this. The baby's now born with a defect. You're in the hospital constantly, you're going to doctors for appointments. It's overwhelming. You can become depressed just because of that. Maybe you have had a death in the family or a loved one, or maybe you experienced some complications during your pregnancy that has frustrated you so much. So I'm just giving you some examples of postpartum depression and just saying that it's real, it exists. And as mothers, you should reach out to other women who are first-time mothers or even third-time moms, second-time, whatever number may be. If you have friends or family, always check in. And COVID has taught us that, the pandemic. Check in on your loved ones and your friends. How are you doing with the baby? Do you want to go to the store? Can I look after the baby for you to get you to do what you want? Next slide, please. Okay, so I put this here but just to be controversial, okay? Because the internet makes us believe that every woman has a baby and snaps back to her pre-baby body, you know? Within 3 weeks, my stomach is flat. I can fit into my jeans and my dresses before I had a baby, and it's really a lie. It's a struggle. And women are under a lot of pressure for many reasons. In the chat, if you can help facilitate mDoc, can you tell me, some of the participants, what are some of the pressures you feel you or women in general are under after having a baby? So if you have time for at least a few seconds, just in the chat, just list some of the things you feel that are demands society places on women or something that you have experienced yourself post-pregnancy. Lose weight, you feel bloated? Yep, absolutely. More comments, please. Let's not be shy. Are there any more comments?
So we can please put in some comments, make it really engaging.
Yes. I've been talking for a while.
I know, right? I'm here with you.
You know, Adora put a comment in to start preparing for the next baby. I must say that that's one of the things that really irritates me is you just had a baby, you haven't even adjusted to your new life, you haven't even gotten into a routine of how you're going to, you know, function as a family, and someone's already telling you, oh, so when's the next baby? It's absolutely inconsiderate, you know? Nikki has put here to adjust well to all the changes. They expect you to just get on with your life. Everything should be back to normal very quickly. So these are some of the, pressures, absolutely. Right? Joyce has said that she didn't know that preeclampsia can happen with multiple pregnancies. So maybe she thought it was maybe a new mom or first-time pregnancy. That's a good one. So as you're chatting, if the person facilitating can list the ones that I've put on the slide, are some of the pressures and demands. What's the first one, please?
Okay, the first one you have.
Yep. I've mentioned that. You feel pressure to get your body back to how it was before you had your baby. Next.
Yes. Okay, so do you want the ones on the chat? Are those the ones you want me to?
No, no, the slides have their own answers.
Okay. Okay. So but
satisfying your husband's needs while juggling the baby. Because now, you know, keeping your home tidy. People expect that your home should be in order when you come home. It should be clean all the time. Meanwhile, you may have a small child that's 3 and now you have a newborn baby and you find it difficult to keep your house clean. Maintaining a social life. Being able to return to your job or your career or studies if you're studying. Yes. Next, there's still more on this slide. So here are some of the social media pressures, right? These are the mediums that put women under pressure. If you have an account, any of these, you know, social media forums, it doesn't help because you go to Instagram and Facebook and Snapchat and all these social media forums, and all you see is pictures of celebrities or a friend who's looking so fantastic. They portray that their lives are so wonderful and everything is so easy. And you know that some of them have had sleepless nights like you, okay? But that's not what they're showing the world. They're showing that, you know, I can do it all. That is so easy. In the chat, very interesting feedback here, if you don't mind, if I just take a few seconds to share. There's pressure to be superwoman. There's pressure that you should eat a lot so you can feed the baby well. You know, when you're pregnant, is that saying that you should be eating for 2 when you actually shouldn't? Because the more weight you put on during your pregnancy, there's an effect on you. And, you know, you're not meant to eat for 2 just because you're pregnant. You're just meant to eat healthy. So there's a lot of myths about that. Yep, going back to normal size, going back to work. People expect that you should just resume work within 3 months, but maybe you need 6 months. Maybe you need more time to get yourself together to go back to work. Right? Chiagoze put, so if you're experiencing postpartum depression, what can you do to feel better, especially if you're dealing with the risk, 1 or 2 risk factors? And I'm going to go into that in a few more slides. Joyce said, trying to nurse a baby who does not latch on, you feel inadequate. Absolutely. There's so much encouragement, right? From nurses, doctors, even the internet when you read, right? About breastfeeding, breast is best. You're always told that breast is best, the natural bonding between mother and child, the nutrients the baby is getting. But there are some women who really, really experience difficulties breastfeeding and end up never breastfeeding because the baby doesn't latch on or they have some other issues. They can't get past the pain. So like Joy said, you feel inadequate, you feel less of a mother. But that again is societal pressure, you know? Else? Pressure to receive all visitors even when you're tired. This is a good one. You had your baby, everyone wants to come see the baby, but you're tired, you had sleepless nights, and you're trying to please everyone, but actually you're not welcome to receive visitors. Okay, thank you for your comments. I'm gonna go on to the next slide now. Okay, so postpartum care. What is postpartum care? Well, you've had your baby now, and it's now time to look after mother. Oftentimes, some of you would have experienced this. People say, oh, how's the baby? How is she? How is he? How are they if you have twins? How many people actually say, how are you? You, the mother, how are you? How are you coping? How are you doing? Sometimes the mothers get forgotten. They're very key things that we need to pay attention to after you've had your baby, postpartum care. Your health. Make sure you attend your appointments. West African context, England, America, there's different time points in which you'll be able to go into either a clinic or hospital to either get the baby's vaccines, immunizations, if you believe in vaccinating your children. But the mother also has appointments. So for example, if you're someone who had a cesarean, they will look at your stitches, you're tired, you'll be exhausted. So you should try and nap when the baby naps, the same similar sleeping cycles. Also, you may want to do shifts. What do I mean by shifts? If you have if you're with your husband, you're a married couple, perhaps you tell your husband, can you look after the baby tonight? If the baby wakes up, it'll be your turn, unless you have to breastfeed, so that I can sleep and I'll do the morning duty. So you can, rotate the responsibility so that you can get more sleep. I'm sorry, I'm on the previous slide about postpartum care.
Okay, so please move to the previous slide.
Yes. So I'm talking about bedtime, naps. Try and nap with the baby. It's difficult to get the baby in a bedtime routine, but a few months down the line, you will, if you monitor the baby and know what time the baby sleeps and what works to get the baby to sleep. So for me, to wind down my baby, I turn off all the lights in the house. I play music on my phone that's relaxing music to get him in a very calm state. I give him a bath to settle him down, and I find this works. And I try to do it at the same time every night, because by keeping the baby up for as long as possible, without giving the baby a bedtime, a time, you're making yourself more tired. If the baby says up to 10, well, what time are you going to sleep? So I try to ensure my baby sleeps at 8:30 p.m. every night so that I can have at least an hour to myself with my husband, whether it's to watch TV or read a book or pray, whatever it may be. So try to get into a routine. Don't just leave things to be. And next thing about postpartum care is physical activity. Okay, it's really important. Tie a wrapper, put the baby on your back. If you have a stroller, and go for walks with the baby. Not all of us is in a position to go to a gym, pay money, and have membership, but there are different ways you can exercise. Going up and down the stairs, those are things you can do. And here, I mentioned pelvic floor exercise. Some of you may or may not have heard of this before, but basically, this is to strengthen your muscles around your bladder, yes, and your vaginal area, okay? Because if you don't do exercises to strengthen these muscles, you will find that you urinate on yourself. You actually can pee on yourself because your muscles are weak. And sometimes women don't talk about it, and it's not shared knowledge that there are exercises you can do, like hold your, you can hold your, clench your bottom and hold it for a few seconds every day as much as you can to strengthen your those muscles I'm talking about, your pelvic floor, right? So it's important, and it also can help to improve sexual intercourse after pregnancy. So it's really important that you work on those pelvic muscles. And then social life, right? Because you can't just be home all the time. Depending on your situation, whether you have family close by or friends that you can trust, the most neglected person postpartum is the husband, okay? Because you have a baby now, wakes up, sleep, the pattern has changed, and the husband is there. Sometimes they tend to feel ignored. To make time for him, can someone else look after the baby? If the mother-in-law is around, or the mother is around, the grandparents, or whatever support system you have, someone can look after the baby, even if it's an hour, so that you and your husband and go out, whether it's to eat or walk somewhere, just to give yourself a break from the baby. Okay. And also, if you have friends with children the same age, arrange to go somewhere, even if it's for a walk, wherever it may be. You and your friends, take your children and go. And the reason why I like that idea is because that's the nice way to share with your friends. You know, they can give you tips, especially if you're a first-time mom and they've been there before, how to cope with some of the things you may be struggling with. Okay. I put here join a new mothers group, but it all depends on where you are in the country and whether such a thing exists. And there's no reason why you can't set it up. Maybe in church, suddenly you see that during COVID, a lot of babies have come, COVID babies, we call them. A lot of moms gave birth 2020, 2021. Why can't you start a mothers group in church to support the mothers? So these are just ideas of, some of them are more essential, obviously. The first points about going to your appointments, your eating, drinking, resting, and the social. Next slide, which is the last one. Okay, so all mothers, both new moms and experienced mothers, get stressed at times. Despite when anyone tells you that it's all wonderful all the time, everything is perfect, we all get stressed in motherhood. It is a normal experience, okay? And some of these points, I mentioned it previously about getting adequate sleep, because if you don't sleep enough, you'll be cranky, you'll be irritable. The smallest things will just irritate you. So you have to find a way to get sleep, even if it means you do shifts. You sleep at a certain time, your husband sleeps at a different time, whatever works, napping in the afternoon to help you get your rest. Please try to get adequate sleep, because if mommy's not well, you can't be your best for anyone. The next point is read. Reading is therapeutic. It takes your mind off things, whether it's a novel, a book, whether it's your Bible. Read if you can. You can be breastfeeding your baby or using the bottle, and you have something interesting that you're reading. Okay, there's a lot of positive things you can do. The third point, maintain a gratitude or writing journal. Some of you may or may not have heard this before, but you can get a notebook. If you don't, it doesn't have to be a formal journal. You can get a notebook, write down your experience, what you're feeling, your thoughts, or what they call a gratitude journal. A gratitude journal is writing down every day what you're thankful for. And I know some people who actually do this, and it works really well. They wake up, today I'm thankful for my life, my health, my family, my job, whatever it may be. And every day, because suddenly you're not dwelling on the things that are not working well in your life. You're dwelling on the things that are working well. So it lifts up your spirit and your mood. So that's why I put that there, because I know people who do it and it's really working for them. One of the most important, audiobooks, group chats, and journaling. So Nicole from New York, hi Nicole, has said that she listens to audiobooks. So you don't have to actually read a hard copy book. Audiobooks she has found to be quite helpful for her. Okay, and that's another good point. Just looking into the chat. Group chats, so she also said, and journaling. So group chats, for those of you who use social media forums, you may decide to join a group. There could be a new mothers group, whether it's from your church, your community, a new mothers group. And in the chat, they share a lot about their experiences and give advice on motherhood. So those are great ideas. If you don't have them in your life, there's no reason why you can't create them and it's a good way to meet people. This other point, create your own village of family and friends, means a lot. No matter where you are in the world, West Africa, East Africa, America, England, if you isolate yourself as a mother, you're not doing yourself or your child any justice. When I mean create your own village of family and friends, let's say you live in Lagos, or your relatives are in Abuja, your relatives are in the East, in the village, or your relatives is in Ibadan, right? Your relatives are not close to you. That does not mean that where you live, you cannot form your own community, whether it's through church or people you went to school with, of family and friends to support each other so that your kids can grow together, so that you can exchange information and friends. So don't isolate yourself. Create your own village no matter where you live, okay? Exercise, I mentioned earlier. Exercise is good for your health. If you're feeling heavy, you're not gonna feel at your best. Can't go to the gym, stairs, walking with the baby, that fresh air is good for your mind, your body, and your soul. I've mentioned eat healthy already. I've mentioned hydration, which is drinking water. The other point I put here is invest in yourself. What do I mean? Well, you're busy looking after everyone, whether it's your husband, your partner, your children, your parents, your aging parents. As women, you're always looking out for someone. What about yourself? Have you invested in yourself? Is there a skill you want to learn? I have met mothers who, during their maternity leave, they want to learn how to bake cake. Something they've never tried. They want to learn how to sew. And if you see some of the things they're creating, they're taking pictures, they're posting, it's now turned into a business. Is there something you've always wanted to do that you just, for whatever reason, you don't have the time, you never found the time to do? Invest in yourself. Learn how to do something you haven't done before. You will thank yourself. You will feel a sense of accomplishment and reward for yourself. Almost there, almost towards the end. Another point is pamper yourself. What do I mean pamper yourself? It's different from investing in yourself. Get your hair done. Get your nails done. You know what I mean? Do simple things for yourself. Go and buy a new dress. You know, it doesn't have to be material things. I'm just giving an idea. It could be something else. Yeah. But pamper yourself, because you can feel burnt out looking after the baby all day, looking after the family, and you feel that you have done nothing for yourself. So don't forget yourself. The last point I put in was meditation, yoga, and Pilates. This is all quite Western in a way, you know. But for West African context, it can be praying. It can be locking yourself into a room, closing your eyes, and praying. During my pregnancy, because it was during COVID, and I was scared a lot because, you know, it was COVID. Everything was on lockdown, and it was, you know, it affected, I think, England and America a lot more in terms of the number of people dying than West Africa. So I was really scared to have my baby. And at some point, I was thinking of having the baby at home than to go to the hospital where I can catch COVID. So what I used to do during the pregnancy is I would put my husband, my children to a different room. I would stay in one room, close my eyes, listen to Christian music, gospel music, or read. That's what I mean by meditation. And I felt that that was good for my well-being. It made me feel positive, and it gave me a sense of hope. So there's so many ways here, tips and points I hope you can take away with you about how to cope with stress. I hope you will implement this in your life if you haven't done so. And I hope that you have a village, family, or friends, because to be honest with you, I couldn't have gotten through pregnancy and COVID, and now I'm back to full-time work, you know, with 3 children. There's no way I would be where I am today without my husband, my parents, even though they're not close to me, my sister, my friends, and my in-laws. There's no way. Their encouragement and support is the reason why I was able to, like, you know, cope. So that's it. I hope you enjoyed the presentation today. I hope you find it useful, and I hope you share. Thank you.
All right, thank you so much. Yes, we certainly did enjoy the presentation, but we just didn't enjoy it. We actually learned a lot as well. I think we'll be having some questions in the chat. I can't see any yet. And yeah, I can't see any questions yet, but I do have some. So while I encourage the house, let's keep our questions coming. Our speaker is well able to tackle them, right? So my first question is, so as a mom, right, how do you know when to say no to the help that you have around you, being that you need the help around you, right? And you just gave birth, you need that help, you need the support. But at some point, sometimes that support can actually become the problem, right? And put a lot of these pressures that we mentioned on you. I had that experience. I mean, so do you have any suggestions as to how to really tackle that? Because if you still lose that help at that point in time, then you will still be under some more pressure of, you know, not having someone to support you with the baby, but that person is putting, or the people around, maybe putting some degree of pressure on you. So how do you handle that? I think that will bring us to my next question. Thank you.
That requires a level of diplomacy, because culturally, there's no nice way to tell someone, no, thank you, without them being offended. They will always be offended. I'm here to help you. You should be grateful. How dare you? But I'm being quite honest with you. I feel like this global pandemic we're in has changed the narrative. Everyone is focused on their mental well-being because it's the part of us that we've always ignored. we always concern ourselves with our physical being, you know, like whether you're physically unwell. But now the world is focused on your mental well-being. If the help you're getting is mentally making you stressed, whether you're losing out on sleep, you're always angry, you're finding yourself hostile, how can you be your best for your husband or your baby? I think you should actually have a conversation to say, I'm very grateful for the help you're giving me, but I think I would like to do, you know, I would like some, you know, some space, or maybe let the person go, even if it's for 2 months, and reevaluate whether you want them to come back to help you or whether you can be fine without that help. It's okay to tell them, but you need to start from the sandwich effect. Good news, negative news, good news. So first you tell them, thank you for the help. Sorry, I really think I want to try doing this on my own. Yes. If I need you, are you happy for me to call you back? That's how I would do it. Now, everyone else is quite different. I'm looking at, are you happy with that, Annie?
Yes, thank you so much. So we have a question or two or so in the chat, right? One is, hello, how do I help? This is from Olabisi Dabli. She says, how do I help a friend who I suspect has postpartum depression? What do I look out for? And how do I help without making her defensive? People can be good at hiding, you know, depression. Yes.
That's a very good question, Olabisi, because the thing is, if you approach your friend, like you said, your friend will be defensive. It's really, really a delicate balance. And some of the signs of postpartum depression is loss of interest. So if you know this friend well and the things the friend used to be interested in, suddenly they withdraw. So your friend may not take calls. You may say, oh, it's because of the baby. You know, she's busy with the baby. Doesn't want to speak to anyone, doesn't want to see anyone, may not be interested in her appearance. So she's not interested in doing her hair. She's even struggling with the baby, feeding the baby, even maintaining the baby, keeping the baby, you know, the upkeep of the baby starts to suffer. The baby's now being neglected, right? And the friend is isolating themselves more and more from family and friends. It's quite dangerous because the friend will have no one at all. And to be honest with you, Olabisi, you have to talk to your friend and say, I'm concerned, I'm worried about you. I feel like you're struggling. Is there anything I can do to help? Can we talk to someone? Can we go to a clinic? Can we get you help? You have to actually be open, because no healthcare professional, whether it's a doctor or a nurse, will see your friend without being referred. Does that make sense? Your friend has to be the one to go out and seek the help. You can try to do it on your friend's behalf, but it might not work in the health system unless you have a friend that's a doctor or nurse that you can get to talk to your friend. But even then, your friend may be defensive. So my approach would be to actually go to the friend and say, I'm really concerned about you, and share what the observations are, what you're seeing to your friend, and say, can I come with you? Can we go see someone? Even if it's a clinical appointment, can we go see someone? Because I feel like we need some help. That would be my approach.
Awesome. Thank you. So I'm sure that answers the question. So I think there's one question here. So it says, are there everyday actions that can worsen diastasis recti? And then what are they? And can diastasis recti heal? And how long would it take to heal? Not sure if this is a fair question to throw at you, but yeah.
No, it's a good one.
So is that?
It's a good question. And Chigozie, I've done a lot of research on this diastasis recti because I didn't know about it. In fact, I'm trying to remember how I came to know about it. I don't remember right now, but I feel like it's a condition that is not talked about enough. It's not out there enough. And there are everyday things you can do. So heavy lifting worsens it. Heavy lifting, even lifting your child that's 3 years old worsens it, because what you're doing, so remember, this is your abdominal muscles and they're split. Yes, there's a gap. That's why you have a pouch on the outside of the stomach. Everyday activities such as heavy lifting can split it. If you do exercise and you don't do exercise that is specifically tailored for diastasis recti, there's exercise for it. If you go to YouTube, if you Google it, exercise for diastasis recti, you can see that it's different from someone who doesn't have the condition. So you can even worsen it by doing sit-ups, sit-ups, yeah? So heavy lifting, assuming you are a clinician that works in the emergency department and you push a stretcher, like hospital beds, you're worsening it because you're pushing something that's heavy. Even sitting up and sitting down, rising up and down can affect it. So we have to be very mindful. I encourage you to do your own research on it. Can it heal? Yes, it heals. If you're into the whole, like celebrity things and social media, Kelly Rowland, who is one of the Destiny's Child figures, she had it after the second son, and she put videos. I watched her on Instagram of the exercises she was doing. Of course, she has loads of money. She had a personal trainer. Our lives are different. She was showing the exercises she was doing to help her diastasis recti heal. It can heal, and in terms of how long it takes, you can have it well over a year. You can still have it, and it may not heal. And if it doesn't heal, the corrective action is abdominoplasty, which is a tummy tuck, which is surgery, which costs money. And I have a friend in the United States who had it so bad that when the doctor assessed her, her intestines was poking out through her stomach wall. That's how bad it was. Because what happens is the doctor will measure your gap. So she went and had to have surgery to actually, a tummy tuck, that's what they call it, to repair her stomach muscles because her own was so severe. So do your homework. There's a lot of information about it. If you go to YouTube or just Google, there's a lot of information.
Awesome. Thank you. There's another question in the chat. It says, how do you know when you have postpartum depression? How do you know when this is not sadness and it's actually postpartum depression? This is from Nicole Yarel. Yes.
Okay. She says, how do you know if your postpartum depression needs medical intervention? And that's a fantastic question. And to be honest with you, often the mother who is experiencing it doesn't know. Oftentimes you don't know it's postpartum depression. You just feel it within yourself. You may feel, oh, it's because of the baby. I'm just down, Oh, it's because I'm struggling to cope with the routine. Oftentimes you don't know, and that's what makes it very difficult to diagnose and very difficult to get help, because it's not something that you can pick out. Sometimes it's the people around you that notice you need help that will now say, I think you're struggling, or can we get you help? And sometimes, Nicole, depending on the country you're in, because in England, when you have a baby, months after the baby, there's what they call a health visitor. It's a nurse. She comes to your home and she talks to you about how you're getting on with the baby, asks you questions, and sometimes they may notice that you are suffering from depression and do a referral for you to go get some help. But again, that's a different system in a different country. So sometimes, Nicole, you actually don't know you have that you don't know you have it. That's number one. And you don't know you need medical intervention. And that's why it's a high risk factor. Thankfully, the numbers are not high in terms of postpartum depression resulting in, a woman, for example, taking her own life, resulting in something of that nature. But it's out there. And I do think that if we do things to prevent it, we don't have to go through that. There are things we can do to prevent postpartum depression.
All right, thank you.